Hi, I'm Dr. Don Mohs, and I'm one of the ear, nose, and throat doctors at the South Bend Clinic. And I'd like to discuss tonsils and adenoids today. Um, First of all, what are your tonsils and adenoids? They're actually lumps of tissue, in the back of your throat on either side of the back of the tongue, and that's what we call the palatine tonsils. And then in the very back of the nose is the adenoids. It's similar tissue. And then there's a little tissue in the back of the tongue that we usually don't address, and that's called the lingual tonsil. What they are big groups of immune cells whose job it is, or was when you were first born and a small child, to act as the sentries of the throat. Everything you breathed or swallowed went by the tonsils and the adenoids, and those tissues identified friend from foe and told the rest of the body whether or not you need to make antibodies against those things. By the time you're an older child, they don't really have much function anymore, so if they're removed, you don't end up being immune deficient, and you are not more susceptible to having infections. In fact, often the reason we remove tonsils and adenoids is they actually promote infection. For example, strep throat, which is a type of tonsillar infection. Or the adenoids can be causative of ear infections in small kids, and we often do adenoidectomy at the same time as putting tubes in small kids. So what do we do once your doctor has decided that you're a candidate or your child is a candidate for tonsillectomy and adenoidectomy? Well, the surgery is done under general anesthesia. So you go to sleep for it in the operating room with an anesthesiologist that is in charge of putting you or your child to sleep. In the case of small children, they usually go to sleep with a little mask and breathe some sweet smelling gas until they drift off. In the case of older children and adults, they usually have an IV put in the arm beforehand, and then through that IV medicine is given. They also breathe a little gas, and then they drift off to sleep. While the person is asleep, a little tube is put in through the mouth into the lungs by the anesthesiologist, and you're hooked up to a machine to help you breathe. Once that's done, you're laying on, or the person who's having the surgery is laying on the operating room table. We put a little device that holds open the person's mouth. We inject a little numbing medicine, very often right behind the tonsil, and then we use a small instrument that's like an electric pen, and there's a variety of types, but they all do essentially the same thing, is we cleanly scoop out the tonsil with this electric pen that seals blood vessels as it's removing the tonsils. So at the end of the surgery, where the tonsils used to be, it'll be raw, but it'll be smooth, sealed, and not bleeding, and hopefully somewhat numb. And then in the case of doing adenoidectomy, we essentially do the same thing, but through the throat, but high up in the back of the nose, once we've retracted the palate and we take out the adenoid in that same manner. After the surgery is done, then the tube is taken out of your throat and you go to the recovery area, wake up, and you're there for generally a couple of hours, and then most of the time you end up being able to go home. In the cases of certain circumstances where you have to stay in the hospital, then you go from the recovery room up to your room. The surgery takes about 45 minutes to an hour, sometimes a little more, sometimes a little less. The recovery is the thing that takes a little longer than that, though. And the way you recover from tonsillectomy is similar to the way you might recover and heal from having a scraped knee. So let's say you're a child riding a bike and you fall on the pavement and you have a skinned knee. Well, we don't take that skinned knee and try to suture that closed. We just allow that to heal on its own. We call that healing by secondary intention. A scab will form on top of that raw area, and that scab protects the area as the skin grows in from the edges, and a week or two later the scab peels away and there's this fresh layer of skin there. Well, the same thing happens in the back of your throat where your tonsils and the adenoids used to be. You'll have a raw area and there'll be a scab there, but instead of this hard, crusty scab like you might have on your knee or your elbow, you'll have this white, cheesy stuff, and that's the normal scab that's constantly exposed to saliva. It's not a yeast infection or thrush. It's not an infection. It's just a normal process. The things to expect afterward is a little bad breath. The uvula, that thing that hangs down the back of the throat, may be a little swollen, so you may have some snoring the first day or two after surgery. You may have a little bit of blood in the saliva the first 24 hours, and then again, maybe 5 to 7 days after surgery, you may notice a little bit of blood in your saliva after coughing, for example. And you say, well, what's going on with that? Well, that's akin to having that scab on your knee peel away from the margin of the wound if you bend your knee before the wound is fully healed, and you might have a little bit of bleeding, and then your own clotting ability takes care of that. So if there's a little bit of blood in the saliva, say 5 to 7 days after surgery, we usually have you gargle with some ice water or suck on a ice popsicle, something along those lines. The cold helps make the blood vessels clamp down, and then your clotting ability takes over from there. In rare cases, you might have bleeding that's significant enough that we have to address it, possibly even in the operating room. But having a little bit of blood right after surgery and then a week later is very common. Often there's ear pain after surgery, and it's not because you have an ear infection. It's because the same nerve goes to your tonsils as goes to your ear. It's called the glossopharyngeal nerve, and that's very common, not right away after surgery, but in the second week during recovery. In the case of adenoidectomy, or removing this tissue in the back of the nose, often in small children there may be a transient change in the voice, especially if the adenoid was particularly obstructed and your voice may be kind of muted to begin with. Then you may have a voice that has some nasal escape of air, and it may sound a little bit high-pitched at first, but generally that goes away within a few weeks, and it's extremely rare for something like that to persist. After surgery, the most important thing is to drink plenty of fluids. It's going to hurt every time you swallow. It's kind of like having that scab on your knee, and it hurts a little bit to bend your knee, but unlike your knee, you don't have to bend it, but you have to swallow. And so if you or your child are not swallowing enough liquids, then you can get dehydrated. No one starves in a hurry, but people will get dehydrated in a hurry if you're not drinking the liquids. And so from the get-go in the recovery area, generally the nurses have you start drinking liquids. If after a few days you're still worried about not taking enough nutrition because that's all you're taking is liquids, well then you can supplement that with either smoothies or instant breakfast, or even Boost or Ensure, or one of those brands of liquid nutrition. But the most important thing is to drink plenty of fluids. Often right after surgery we give narcotic pain medicine. It's usually in the form of a liquid. It's usually a combination of Tylenol and hydrocodone, or sometimes oxycodone or codeine. And then your doctor may opt to give an anti-nausea medicine, or may not opt to give an antibiotic, depending on the particular circumstances. The surgery itself takes an hour, but the recovery from the surgery can take up to 2 weeks in an adult. Children recover faster than adults, but it's not surprising at 1 week that you may still, as an adult, be requiring narcotic pain medicine because of the discomfort. No matter what, generally a week is the hump day where you get better on a daily basis thereafter. Prior to surgery, we have people not taking any aspirin, Motrin, Advil, ibuprofen, Aleve, or any of the non-steroidal anti-inflammatory drugs. And that's because they're actually potent blood thinners. Even a baby aspirin is a potent enough blood thinner to help prevent things like a heart attack or a stroke. But what we want is not to have your blood clotting impaired prior to surgery. After surgery, however, there are studies that show that you can safely use medicines like Motrin as long as it's not on an empty stomach, and that shouldn't increase your risk of bleeding. And that can often be alternating with the Tylenol or the Tylenol with hydrocodone that we give. We also have you not eat or drink anything after midnight the night before surgery. That can vary depending on the time of day that the surgery is scheduled for, particularly in young children who may not be able to tolerate being without food or drink for very long. But in general, the rule of thumb, particularly for adults, is nothing after midnight the night before, unless your doctor or the surgery center or the anesthesiologist lets you know beforehand a different rule. The reason for this is when you're being put to sleep under anesthesia, there's a moment when you're going to sleep that you don't have the normal protective reflexes that prevent things from going from your stomach into your lungs. And so we don't want to have you be at risk for a particular type of pneumonia called aspiration. The risks of surgery include the risk of any surgery, which include risk of bleeding, infection, risk of anesthesia. The unique risks of this surgery really are oral or dental injury, In small children that have loose teeth, sometimes if the teeth are really loose, we elect to remove them and then give the tooth to you as a parent rather than run the risk of the tooth being loosened and then displaced and possibly even aspirated. The tonsils and adenoids don't really do anything by the time you're older, so they're not going to be rendered immune deficient, so that's not a risk. And the very reason, again, that tonsils and adenoids may be removed is to prevent infection. I think that pretty much covers most of the issues that people have questions about with regard to tonsillectomy and adenoidectomy. Thank you for your attention.